Hello and welcome to your genitourinary medications slide. Our objectives for this course of your PowerPoint presentation are to describe the mechanism of action, describe therapeutic use, describe the side effects, patient teaching, nursing considerations, recognizing complications, and applying the nursing process to each one of these medications. The purpose of these medications fall into two categories, either to treat the infection, so the UTI, urinary tract infection, or the cystitis, the bladder infection. Or the second category is to relieve the pain related to the infection, the UTI or cystitis. The goal of treatment then is going to be absent of the UTI symptoms, negative urine cultures, and of course a decreased white blood cell count. So how do urinary tract infections typically occur? There's quite a few factors that are involved, and I think this video helps explain multiple ones. So watch this video with me.
A lot can happen in a day that can disrupt your natural vaginal balance. Here are the top 5 everyday things. Some condoms contain spermicides that can kill beneficial bacteria, while the chemicals in certain lubes are more alkaline than natural vaginal pH levels. Antibiotics wipe out both the good and non-beneficial bacteria, including your vaginal flora. Stress can impact the immune system, which helps regulate your body's balance of beneficial bacteria, and in turn disrupt the natural balance of bacteria and yeast in your vagina. Both tight pants like your favorite skinny jeans and sweaty clothes like your workout gear can trap heat and moisture, creating an ideal environment for non-beneficial bacteria to grow. Hormone changes can occur throughout your life. Pregnancy, as well as periods and certain oral contraceptives, can all cause hormone levels to rise, disrupting vaginal pH levels and leaving you anything but balanced. Maintain your balance every day with Azo Complete Feminine Balance so you can own your day.
Right. So complementary therapies before we move into medications. We have cranberry juice. So, a lot of people like to try to do cranberry juice as a preventative. It can prevent UTIs is what studies have shown, but it's not really effective once an active infection is occurring. So it's not really going to make that course of treatment any shorter or anything like that. Also probiotics, because it does destroy, when you're taking an antibiotic, does destroy your natural bacteria as well as the bad bacteria. So probiotics can help in between. So you do need to take these separate from each other. So if a patient does want to do probiotics, they need to take it at least 2 hours after their antibiotic, okay, or antifungal medication, in order for that antibiotic to also not wipe out the probiotic flora as well. Okay, so the first type of medication that we're going to talk about are sulfonamides and trimethoprim. So those are some examples of the type of medicines. These ones are going to inhibit the bacterial growth by preventing synthesis of folic acid derivative tetrahydrofolate. So that makes this a bacteriostatic medication. Remember back into our infection lectures. So these are going to treat UTIs, especially related to E. coli, which are the most common type of UTIs. Complications of these, though, are going to be a hypersensitivity reaction. So these can be sometimes seen as Stevens-Johnson syndrome. So this is these medications are probably going to need to be avoided in patients that already have allergies to sulfa products, thiazide diuretics like HCTZ, and sulfonylurea type oral hypoglycemics because of the sulfa. So this example would be glipizide, or loop diuretics like furosemide. So if they already have an allergy to any of those 4 types of medications, they're probably going to have an issue and reaction similar to this. So the first sign of this happening is, of course, going to be a rash, and they need to stop taking the medication and then list it as their allergy from then on as well. Blood dyscrasias is another complication. So what does it sound like? It's blood that's breaking apart. So it's a hemolytic reaction. And so you need to observe for bleeding, sore throat, and pallor because they are going to be bleeding somewhere. So we need to take a baseline CBC as well as periodic CBCs to watch that hemoglobin and hematocrit, okay? And to detect any kind of hematologic disorders that may develop during the course of therapy. So next is crystalluria. So these are little crystalline particles in the urine. So these can aggregate the kidneys, the ureters, and the bladder, and that irritation can often also obstruct flow of urine. So that can also lead to an acute kidney injury. So to prevent any further complications of this crystalluria causing that injury, we need to increase the fluid intake on these clients. So monitoring their I's and O's, and we want to look for an output that is at least 1,200 milliliters per day, which is a little higher than most people, but we want to really flush out all those little crystalline products so that there's not an injury happening to those kidneys, okay? The next complication is kernicterus. So this is related to liver. So kernicterus, you're going to see jaundice and increased bilirubin levels, and especially those if this is given to a newborn client. This can be neurotoxic for them. So they don't really have the liver function fully developed yet, and so this can be quite detrimental to newborns. So we need to be very cautious when we see this in those type of clients. The last complication is hyperkalemia. So this, of course, is high potassium levels. So we need to monitor the potassium levels, and especially more so if they're already taking ACE inhibitors, because this can already also affect their potassium levels. If the patient already has an impaired kidney function, it may be a concern while taking this medication, and so we may need to look at lowering the dosage to prevent any further kidney injury. Some precautions or contraindications for this type of medications are going to be folate deficiency, of course, because that's how this medication acts, is on the folic acid. Some education for these clients are going to be using, of course, alternate forms of contraceptives because it is an antibiotic, and of course taking the entire course of therapy to make sure that it is going to completely rid of the bacteria causing the UTI. The second type of medications used for UTIs are going to be urinary tract antiseptics. So these are bactericidal and bacteriostatic antibiotics and used to treat acute UTIs or prevent recurrent lower UTIs. So these may be clients that are just generally prone to developing UTIs over and over and over. So they may be taking this kind of medication as a prophylactic to prevent that from happening. So some complications we might see in these types of clients taking this medication is GI discomfort. This could be just not really wanting to eat, which is called anorexia, or it can progress to nausea, vomiting, diarrhea. We can decrease this effect by administering it with milk or meals, or we can reduce the dose if it is becoming severe. They can also have a hypersensitivity reaction, but for these types of reactions, they're going to have like fever, chills, and respiratory symptoms. So you're going to look for dyspnea and cough, chest pain, and infiltrates in their lung. Okay, so this could develop into pneumonia if it's not caught. Once this starts happening, as long as we stop the medication, this can usually resolve on its own after several days. And of course, they should not take it again. It should be now considered an allergy. Okay. Blood dyscrasias, of course, just like the previous medication, you're going to monitor for bleeding. And then now peripheral neuropathy. So this is neuropathy, tingling and numbness to like your fingers and your toes. They're going to even can progress to muscle weakness, chronic kidney disease clients are an even more risk for this type of complication. It can lead to toxicity as it just kind of sits around and their kidneys aren't kicking it out. So we need to avoid chronic use of these medications as much as possible for those types of chronic kidney disease patients. So they probably should not be taking this prophylactically on a long-term basis because of this complication. Another complication they could have are headache, drowsiness, and dizziness, but they just, if these develop, they should just report it to their primary doctor, and they'll determine risk versus benefit depending on their other allergies and other medications that they may have tried in the past and if it worked or not. Okay. So some precautions, of course, are going to be renal impairment, especially with older adults when their renal function starts to decrease, and then infants which don't have quite the kidney function developed yet. Some education, these are going to be the ones that will turn your urine rest to yellow and then to brown and can stain their teeth. Okay, especially if they are the type of clients that like to chew up their medications or open their capsules, and it's going to definitely stain their teeth. And then, so we need to provide that education is a normal side effect and resolves once the course of treatment is done. They need to complete, of course, the entire course of therapy as it is an antibiotic. All right, so the next type are going to be fluoroquinolones. So these ones are going to be the ones that you might be more familiar with, the Cipro and the levofloxacin. These are broad spectrum antibiotics, bactericidal antibiotics, and typically used for severe infection or STDs, okay? Complications for these ones are going to include GI discomfort, so we can take these with food, but these ones we do not want to take with dairy products, okay? Another complication is Achilles tendon rupture, so you're going to see pain, swelling, and redness at the site, and of course they need to stop the treatment. This is typically with Cipro, and avoid exercise until the inflammation subsides. This is kind of a weird one. I'm not really sure why it happens, but they've seen it with this medication. Another complication, superinfection. So that's when that thrush, the fungal infection, develops in the mouth, or a vaginal yeast infection. So that curdy cottage cheese like reaction that's going on down under. So we need to educate our clients about the possibility of these happening so that they will report it if it does happen. Another complication is phototoxicity. So we need to educate these clients to wear sunscreen and avoid sun exposure and wear protective clothing. But if they do still, regardless of those precautions, they still develop a sunburn, then they need to stop taking this medication. Okay. Precautions, of course, are going to be anyone under 18. That's just because their kidney function has not fully developed. Another precaution is going to be C. diff. So they may develop C. diff as a result of taking this medication because it also destroys the normal intestinal flora. And then the C. diff takes over, and then they end up with that severe recurrent diarrhea until the normal flora balance recurs, okay? Older adults might have an issue with these, of course, again, with the kidney dysfunction, or if they already have cardiovascular disorders. If their kidney function is okay, older adults typically tolerate well. It's just in the presence of dysfunction. So we can lower their dosage if needed, if there's no other medication that they can be on. This medication also interacts with warfarin, so we need to be possibly looking at their PT and INR and the possibility of adjusting their warfarin dosage to accommodate this, okay? So we need to educate these clients to abstain from sex during this treatment because, of course, especially if it's for STDs, we don't want to continue transmitting the STD until it is fully gone. If we are administering Cipro IV, we need to make sure it is diluted. This can be very irritating to veins, and so we need to give it through a large bore IV, large vein, and diluted and given over 60 minutes. So this is not an IV push. This is a drip over an hour. Okay, and of course they need to complete the entire course of therapy, like if it's the pills. Okay. The last type of medications used to help with UTIs is not actually an antibiotic. This is a dye, azo dye, that produces a local anesthetic to the urinary tract. So this relieves the burning associated with urination. So this does not treat the UTI. This helps with symptoms of the UTI, okay? So some contraindications or precautions are going to be kidney injury and chronic kidney disease, of course. So that just doesn't just sit around and wait in their system for so long. But we need to educate these clients because this does turn the urine red orange and can stain clothes. So those clients with urinary incontinence or leakage, they might want to look into, especially if they aren't already, wearing a pad of some sort so they don't stain their clothes. Okay, this is a very, how that dye works is just gonna turn the urine orange, red orange. Okay, all of these were found in your ATI textbook, chapter 46, pages 373 to 377. On Tuesday at 8 a.m. there's going to be a discussion post opened up so we can you have any questions and answers that we can all discuss as a class. It'll be open through the week just to discuss all of these kind of medications and any questions you may have. Thank you.